Hello, welcome everyone. My name is Ellen McIntyre. I'm the Director of the Primary Healthcare Research and Information Service based at Flinders University. And I have with me a guest, Ian Graham from the University of Ottawa. Welcome.
It's a pleasure to be here.
Now we're going to be talking about the basics of knowledge exchange, I guess. So can you tell me a bit about what you see knowledge exchange is about? Because you've said or written somewhere that it's about a collaboration of researchers and knowledge users. Could you elaborate a bit more?
Sure. So in Canada, we've had a lot of focus on knowledge exchange, and knowledge translation is often the term that's used more commonly in Canada. In the UK, it would be implementation. So part of the challenge is these different terms, and are we talking about the same things or not? But I would argue that knowledge exchange and integrated knowledge translation are about collaboration. It's about researchers working with, collaborating, engaging knowledge users who could be clinicians or managers in the health system or policymakers or members of the public. It could be industry. It could be virtually anybody who could make use of research. And so the notion is, if you want research to be applied, you need to make sure that it's relevant, and the chances of that happening are much greater if researchers are actually working with knowledge users and identifying the problems and issues that they have, and then focusing their research on answering those questions.
So for a new or early career researcher who wants to make sure that his or her research will change the world, what would be some basic or key points that they need to be aware of if they want to move into doing more with knowledge exchange?
Yeah, so the philosophy behind knowledge exchange would be actually engaging the knowledge users at the beginning, making sure that you've got the right, or you're focusing on the right questions. And that doesn't mean that curiosity-driven research isn't still important, but in terms of potentially accelerating the impact of research, it's a good place to start by asking the knowledge users, well, what are their issues? What do they want research done on? What information needs do they have, so that the research that you do can actually be tailored? Because what we know is, in those situations, and if you actually partner during the research with those knowledge users, and there are different funding opportunities in Canada and in Australia, partnership grants, that encourage that to happen, it means that the knowledge user actually better understands the research and why it was done in the way it was done, and then is more confident in the findings when they actually become available, which means since they were the ones who said this is what our issues are that we need research on, when they get the answer, they're much more likely to apply it.
Right.
And it also means, and so there's always this notion of, but you can't engage every knowledge user in every research project. So you need to do the knowledge exchange piece with some knowledge users. But then when you have the findings, you still need to do the dissemination or end of project knowledge translation, because other policymakers or decision makers could still benefit. So you still need to do the more traditional things, but it might not be publishing. If you're wanting to get officials in the bureaucracy, they need short half-page descriptions of things delivered by credible people, or people that are perceived to be credible by them. And so a publication isn't going to do that for you. So actually thinking about what are the needs of those end users in actually receiving information, and making sure that it's tailored to them, and that the medium that you use to get the information to them actually fits with what they're expecting.
So researchers need to change their behaviour if they're wanting to make their research used. But what about the research users? We often hear of them being in ivory towers and quite distant, really difficult to get in contact with. What sort of behaviour change do you think is required from those people?
So knowledge users can be challenging, and what also makes it interesting is you might have clinicians, and you may have the managers or policymakers who are very different in what they need and how you may need to interact with them. So some of the things that I think we need to be thinking about is making sure that those decision makers actually have skills in being able to use and critically appraise research, because they may not have received that in their training. So it's a problem if they don't know the value of research or how to discriminate good quality from lesser quality research. So they need those skills to begin with, but they also need to have a comfort level with actually, and this is the reverse engagement, with researchers, because they may have preconceived notions of researchers being very serious and always wanting everything perfect and wanting lots of money to do what they do and more time to do it. And so they may be reluctant to actually say, well, maybe we should interact in a closer way. So that needs to be broken down as well. So
what sort of opportunities would you be looking at where people, researchers and knowledge users come together?
Well, so it depends on the setting. But I think reasonable advice would be to create situations where we bring researchers and knowledge users together. Right. And that may be in formal settings like committees, but it may be in informal ways as well. Because I think the literature is starting to be clearer about that. It actually doesn't necessarily need to be a formal setting where researchers and knowledge users come together. If they can do it in social settings, then that works as well.
Okay. So we're obviously looking at people changing their behaviour, doing things differently from both sides, but that really, you were also saying earlier that there's a real paradigm shift that's required. Can you elaborate a bit more there?
So if we start with sort of the foundations of the science enterprise, it starts with most of the funding agencies in the world. The dominant mode of funding is researcher-initiated, curiosity-driven research, which is really important. Yeah. And so I'm not minimizing that. But there are very few funding opportunities that actually facilitate or encourage researchers to work with knowledge users. And so I think at that level, and increasingly the NHMRC have a partnership program as part of their portfolio, right, where the intent is to actually do that. And some of these are very large grants. So I think that's very positive. In Canada, there's the Canadian Institutes of Health Research also have a number of funding opportunities that actually require knowledge users to be co-applicants, and they need to demonstrate to the review panel that the question is actually a key or critical one to the knowledge users who are on the grant. So to do this kind of research actually takes money. So we need ways to make sure that we can get funding that would allow researchers and knowledge users to work together. And part of that's a learning curve, but we also know working with policymakers, for example, a sign of success of a policymaker is that they don't stay in a position for very long. They keep being promoted or moved. And so you may start a project. We did this in 18 months. I think we had 6 different managers that we worked with.
I could beat that 5 in 9 months.
There you go. And so that's a challenge for researchers who are just used to being independent and having a lot of control over their own research activity. Yeah. And here, with this model, you're actually working with a partner, and your partner may keep changing, and so you need to keep building up the relationships and redeveloping the trust with the new people all of the time, and that can take time. But if we don't have, if you can't get grants that actually support that, because the other challenge is typically, and I won't speak for Australia, I'll speak for Canada, the incentive system for faculty in terms of tenure and promotion, those kinds of things, don't actually include categories of, there's a service category, but there's not a category around, well, how are you engaging with knowledge users in your research, and what's the impact? Because that's the other piece of it. As I was alluding to, if you work in this fashion, the chances are the uptake of the findings will be accelerated, which also means that the impact will be demonstrated perhaps more quickly than with other forms of research. And so if your university's not actually seeing this as a valuable use of your time, then there's not a whole lot of incentive to do it.
That's right, and I guess the incentives for both researchers and for knowledge users are different, and so you have that tension there.
And so one of the things, when I was at the Canadian Institutes of Health Research in Canada, went around the country promoting the integrated KT programs, funding programs. One of the things that amazed me was there's a lot of interest with young researchers.
Oh, good.
And I think part of it relates to this really strong desire to have an impact. And they get really excited by the opportunity to work with policymakers because they can see how what they do can be translated quite quickly into practice and into policy. And so they're very keen. But they often then told me about, how maybe their supervisors were less enthusiastic because, it takes a long time to develop these relationships, and maybe you're not going to be able to write as many papers as if you had just, put in a grant and done it all on your own.
So there's obviously this paradigm shift requires system changes, but how would you overcome some of the challenges, particularly the researchers? I mean, often a researcher isn't a very good communicator because they're more interested in doing their research. So how do those people develop the skills? And equally with the knowledge users, how do they develop those skills of engagement?
So with researchers, I think we need to really look carefully at postgraduate training programs. The world has changed from what it was 20, 30 years ago, where most of the people who were getting higher or advanced degrees were actually becoming academics. I think now in Canada, it's maybe 50% actually stay in the academy, and the others go to industry, into government, into research institutes. And so the traditional model of training and the focus on peer-reviewed publications and grants may not work really well for a lot of the people that we're actually training.
Because some of them actually become the knowledge users, don't they?
Well, they do.
Go into industry.
That's right. And so they switch sides, as it were. Or they can do, which is a huge asset.
It is.
Because they understand all of the research issues.
Yeah.
So as they bring that to the new position on the other side of the table, they're way further ahead. And they have a comfort level with research and researchers where people who may have never had much interaction with the research community would take longer to come up to speed and may need capacity building in terms of understanding study designs and critical appraisal and how you might be able to incorporate research into the decision-making process.
Yeah, so the organisations on both sides need to make big changes to allow this knowledge exchange to happen, don't they? Because as you said, it costs money, it takes time, and a lot of that time investment is in developing relationships that may or may not last or may suddenly be changed. So how we've been told all the time, well, we need to have the biggest bang for our buck, and it's the challenge of measuring knowledge exchange that's also...
So if we were able to overnight say, okay, we're changing the system and reallocating resources, that would be wonderful. But of course, it's not likely going to happen. So I think another approach is sort of the incremental small wins. And if the academy and research organizations and knowledge user organizations actually start in little ways to try to do this, and if funding agencies can actually think about providing grants to support integrated knowledge translation or knowledge exchange research that's actually bringing researchers and knowledge users together, then I think the experience in Canada is once that starts to happen and people start to see you can, as a researcher, work really productively, and that's not to say, as with any kind of relationship, sometimes it doesn't work out, right? So it's not a panacea. But the data from CIHR's evaluation is that, for the most part, it actually does work out quite well. Researchers find that how they approach research actually changes when they start doing research in this way. The knowledge users also say that how they think about research and using research in their business begins to change. So I think the incremental approach would be to start trying to work in this fashion, and then people will see the successes and be more inclined to want to give it a try. But at the same time, we also need universities to be supportive and to value researchers wanting to do this.
So the more we can share all the good stories about knowledge exchange, the more likely it is that our organisations will change.
Yes, and even when there's bad stories, sometimes it's good to share those too, because there may be learnings about how to engage or how to avoid problems that other researchers might eventually encounter, and that would be important knowledge to know too.
Good. Well, look, Ian, thanks very much for having this conversation about knowledge exchange. I've personally learned a lot about it too, but I look forward to meeting you at some other time. So thank you very much.
Well, thank you. It's been a pleasure.